Welcome to a new episode of Little Eyes, Big Topics, an AAPOS podcast. In this episode, Dr. Jennifer Galvin invites Drs. Honey Herce and Sylvia Yoo to share their insights as leaders in both pediatric ophthalmology and the American Academy of Pediatrics.
Welcome to Little Eyes, Big Topics, an AAPOS podcast. I'm here with Dr. Honey Herce and Dr. Sylvia Yoo. This is Dr. Jenny Galvin, and we're talking about the importance of AAP and the role with AAPOS. Dr. Sylvia Yoo is a pediatric ophthalmologist at Tufts Medical Center in Boston, Massachusetts, and she's an associate professor of Tufts University School of Medicine. Dr. Honey Herce is a pediatric ophthalmologist at Texas Children's Hospital at Baylor College of Medicine in Houston, Texas, and is an associate professor of ophthalmology and is also fellowship director of pediatric ophthalmology and strabismus. Welcome, Dr. Yoo and Dr. Herce.
Thank you. Thank you for having us.
Of course, yes. So one of the main things that we wanted to talk about is why should AAPOS members get involved with AAP? But tell us, both of you, about your involvement as leaders with AAP. And Sylvia, in particular, to start off with yourself, as you're the chair-elect of the Executive Committee of AAP section of ophthalmology.
My roots are in pediatrics. I actually had a longer route to pediatric ophthalmology, having done a pediatric residency before I decided to pursue pediatric ophthalmology. So I was happy to find a way to be able to get back into the AAP. I think that the AAP's primary goal is to ensure children's health. And that also means that they want to ensure that the physicians who are taking care of the children are also going to be valued. So there was a leadership meeting over the summer for the AAP, where the current CEO, executive vice president of the AAP, whose name is Mark Del Monte, he had a quote that I thought was really powerful. And he said that you cannot value children if you don't value their doctors. And he said that more than once. It was tweeted out. And I think that that was a really important way of making sure that AAP not only advocates for children, but they advocate for pediatric physicians as well. So that's one of the big reasons that I am involved and stay involved with the AAP.
Oh, that's outstanding. I love that quote, and I think that's really powerful. Thank you for sharing that with us, Sylvia. Honey, you're also, in addition to your other roles, you are the representative for Yoo, Young Ophthalmologists. And can you tell us a little bit about your involvement as a leader with AAP?
So I had actually started to be involved as a young ophthalmology faculty in the AAP. And one of the reasons that I had stayed in involvement with AAP is the amount of advocacy that you can do for not only your patients, but for the profession. The other thing that had helped keep me in the AAP was how much you could do also within the AAP, within the section of ophthalmology. As a young ophthalmologist and as a young faculty, they actually have a lot of benefits for the residents and incoming fellows as far as writing policy or being involved in the healthychildren.org website that can give information and education information to the parents. And then finally, one of the things that had me join AAP was the amount of advocacy that the AAP actually does for physician mothers, especially for parental leave and for breastfeeding. And that was very important to me to be able to be part of.
No, that's wonderful, Honey. It's very tangible things that we can do as pediatric ophthalmologists, and then not only help us in our professional life, but also the translation over to our personal lives as well. In addition, do you think that why either new AAPOS members or existing AAPOS members, you both have touched on it already, but should join AAP, and the level of involvement that they could do either at the local chapter, statewide, or regionally?
One number I want to put out there is that the AAP is 67,000 strong. So I think that helps us be a strong voice regarding advocacy for children and for pediatric physicians. And then there are districts and state chapters that you can join when you join the AAP. It's optional. One of the things we started to work on is Medicaid payments, which is at the state level, of course. And so being a part of the state chapter, I've been able to connect with some of the people who have already been involved with that. In Massachusetts, it's called Mass Health, and people who know a lot more than me. So I'm learning a lot about what we can do to try to improve Medicaid payments to help pediatric physicians.
That's outstanding. So then there is like a direct translation to not only helping our patients, and their families and the parents, but then even helping the doctors, in particular pediatric ophthalmologists, in terms of the statewide funding issues, since so many of our patients, it's true, are on the state insurance and whatever it's called as we go state to state. So that's really important kind of alignment and network to have with AAP as AAPOS members. I agree.
And one other thing that one of our section members had mentioned, Dr. Donahue in California, was that through his AAP Orange County connections, he was actually able to have their state politicians to listen to their concerns among pediatric ophthalmologists. And they were actually able to visit their clinic. And this was actually during the time whenever the scope practice battle was happening in California. And so I do think that there was a good amount of force from the AAP that also helped from that, just to get connected to your local politicians. They were able to come see his clinic and show them around, and they're actually able to support the vision screening program through the iMobile program as well. So it was actually a very fruitful and productive being part of that local Orange County AAP chapter.
Thank you so much for sharing that, Honey. That's excellent information, because, even if many of AAPOS members, we don't consider themselves political or politically oriented, I think that even having to step out of that thought process, that we all need to become advocates for our profession and indirectly ourselves and our colleagues. And that example that you gave is so powerful, because if we don't get involved with advocacy and even working with politicians, that we're not able to kind of move forward our field in the way that we want to for not only this generation, but the next generations. And so that's a great example of how it was not only fruitful, but hands-on and made it very applicable, sounds like, from what you described.
I want to emphasize that Dr. Saw was contacted, I believe, because he was an AAP member. So as an ophthalmologist, there was something active going on in California there, but he was contacted because he was an AAP member. So it just demonstrates the strength of the AAP voice with advocacy, their credibility in the state house and also federally.
Exactly.
That's an excellent point, Sylvia. Yeah, that's an excellent point. And then also, like you were saying, 67,000 strong, so nearly 70,000 members. And then what we'll also include here is a link that will be a way for our AAPOS members to join. And Honey, can you tell us a little bit more about that link?
So in that link, it actually has the section of ophthalmology. You'll be able to see more about what the AAP section of ophthalmology does. There's a sample of our newsletter on there. And then you can actually join at that area as well. And one of the things that's great about the membership for AAP, and this is only for the section of ophthalmology, is that we actually do get a good discount for it. Residents, trainees, fellows, especially within the first 5 years of your early faculty, you can actually get also a discount also as a member. So it's great to join early.
I think that every AAPOS member should seriously consider doing it, because that is really benefits not only themselves, but their patients and their colleagues. I know that I have really benefited so much from being an AAP member as well as here in the state of Connecticut. So it's really helpful. And what do you think are some pearls that you can share with either a new fellow or a yo, or even a well-established pediatric ophthalmologist in AAPOS who's on the fence of joining AAP?
I think, especially as a young ophthalmologist, is that whenever you have that fellow of AAP after your name,
Mm-hmm.
pediatricians will look, pediatricians will see that, and they will refer patients to you because they know that you also value the basis of AAP. We actually have the young ophthalmologist and the senior ophthalmologist mentorship that you can actually be able to have benefits for networking and support, along with the early involvement in policy. Many of the early advocacy that I've been able to see had come into fruition for helping with physician mothers. Along with that, it's good to get involved with influencing policy for pediatrics. Some of the policy statements that they need help on are in ROP or sports injury or JIA screening or type 1 diabetes. And a lot of those, it's good, especially if you want to be involved early, to be part of AAP, then you can do that.
There are many, many outlets that the AAP is able to reach parents, pediatricians, directing policy, just like Honey mentioned, that directly affects healthcare for children and can also help direct federal level agencies like the CDC. So I think there are lots of opportunities to get involved with education. There's also ongoing courses at the AAP national meeting that are very popular. One is on using the ophthalmoscope that has been going on, I believe, for about 30 years. So great way to meet pediatricians who want to learn better about when to refer and how to find issues that need early treatment.
These are just outstanding pearls. And I think if AAPOS members, if they need to join just one additional organization, certainly AAP should be at the top of their list for all of the reasons that you have talked about in terms of the benefits of the advocacy, the benefits of the involvement, and also about the value of what we do of taking care of children's eyes, that we are with like-minded colleagues, with pediatricians, and also working from the grassroots level. And in addition to that, in terms of the educational component and the personal component about the advocacy for what we can do as if we're mothers, and if for maternity leave, as well as if we're fellows, and if in need of mentorship, that it's wonderful, the SO and YO, the Yo relationship there. Dr. Yoo and Dr. Herce, it has been wonderful speaking with you about the importance of the advocacy that AAP does, the importance of your leadership, both of you in the role that you have within AAP, and how AAPOS members need to become involved. Is there anything else that we haven't talked about that either one of you wanted to bring up on this Little Eyes Big Topics podcast for AAPOS?
The stronger our voice is within the AAP, the stronger pediatric ophthalmology can be. We work with the AAO, we work with AAPOS regarding some of the policy statement work that we do, and with advocacy. So I think working all together is important to be a strong voice.
Very well said.
Thank you for having us. And if they have any questions, feel free to reach out. We have our email. And then if it's not something that we know how to answer, we know Jennifer Reef, who is our administrator at the section of ophthalmology. She knows all.
Anyone who's listening, any further questions that you have, there'll be a link that not only for you to join and join at the much reduced rate as both Dr. Herce and Dr. Yoo had spoken about, but then also any other questions that can be answered that may come up now or in the future.
Thank you so much.
Thank you.
And thank you also.